Start recording. Leon, Kevin, welcome. It's good to see you.
Likewise. Hi, Denny.
Hi, everybody.
Hi, I see Ferris. It's good to see you, Jessica. It's great to see everybody.
Good afternoon, everyone.
All right, we're mindful of people's time. We have a fairly large number of registrants. We fully expect that many of them will be joining us while we're in the presentation, which is fine with us, but we want to share with you some exciting news for 2023 with respect to membership in the Massachusetts Health Data Consortium. Just by way of simplification here, just to free my screen from being covered up by the attendees here. One of the events we have coming up, for those of you who keep close to us, is a very exciting discussion about what real-time prior authorization looks like in action. Many of you may have seen this before. This is a webinar that is open to the public, but what we are working on as a consortium with a number of payer and provider organizations is how do those organizations move toward an interoperable future where prior authorization, among other transactions, price transparency, the No Surprises Act, quality measures, a whole host of use cases for which data exchange is essential. How those actually, what do those look like when we succeed? We know that as actively working in prior authorization, that the journey is not an easy one. It is fraught with internal challenges within organizations, and these are not just technology challenges, these are also cultural challenges, these are also business challenges. How do we go from the world we live in today to a world that is much less burdensome? And how do we do so without making the journey so complicated? And having both Heidi, Chris, and Raj join us for this discussion is very exciting because these are experts in the field, and also they're doing today what many of us are working on accomplishing over the course of 2023. So mark your calendars for November 18th. And let me move forward here. First, my name is Denny Brennan. For those of you who don't know me, I'm the Executive Director of the Massachusetts Health Data Consortium. I'm really glad to have all of you on the call with us today. It's exciting to talk about the work we're doing and the work we have planned for 2023. Why be a member, in MHDC? For those of you who are not and who ask the critical question, why, how, what do I get in exchange for being a member? Well, we've been in business for going on 45 years, and we recognize that organizations need to move fast in healthcare. They have a lot to accomplish, and they can't be burdened by organizations and third parties who aren't directly involved in the work that they have to get done quickly. They have to do that alone. But there is so much that happens in healthcare now, and that has to happen in healthcare going forward, that requires that we go far. We have a long way to go to create an equitable health system, to create a health system that is much less burdensome, that is much more attuned to the needs of patients, members, consumers than the one we have today. We want to move far toward making how much healthcare costs visible and transparent to patients and their families, to the community, but we also know that we have to do more than that. And the journey that is a long journey is one that's best undertaken together. So we put an African proverb, if you want to go fast, go alone. If you want to go far, go together. And we are in the business of going far with our membership. We provide a unique opportunity to network with providers, health plans, government agencies, associations, vendors, and a host of other healthcare professionals on all matters health data related. Being a member of MHDC is being immersed in the world of health data. That's the world that we live and breathe. That's the world where we want to go far. We want to share the collective learnings of our member organizations to advance matters of shared interest so that we can go far together. We want to keep our members informed about the healthcare information technology landscape. The world used to be, the health IT world used to be a CIO world. It's now a world where we have chief medical informatics officers, chief nursing informatics officers, chief data officers, chief technology officers, chief information security officers. The list of C.O. that now involve themselves in the world of health data has grown considerably since we first started as an organization. We want also our members to learn about initiatives that address important health issues that they can accomplish together. We want them to understand what's happening in the health data world at large. As I just showed in the previous slide, what are people doing and where, and how are they advancing the use and value of health data, the accessibility of health data, to a point where we can achieve some of the goals that without a well-managed, standardized health data economy, we can't accomplish. We can't achieve any of the goals that we have, whether they're related to health equity, cost effectiveness, quality of care. The list is long, accessibility. If we don't have a foundation of shared health data that we can work against, we can't manage what we can't measure. We also want to understand and access business opportunities for our members to solve issues together. We have a number of services that we offer as a consortium that are built directly from what we learned from our members. They include the New England Health Exchange Network, or NEHN, which is a health information exchange that recently merged with MHDC. We have Spotlight Analytics, a service that we provide that allows organizations to not only look at economic and utilization data, but also to look at health equity data and community engagement data. And we have a health data collaboration around the governance of health data, our data governance collaborative, which comes with membership, but is an immersion in the regulations, the industry trends, and the issues that are informing how do we go from being a siloed, predominantly enterprise-driven health data system to one that's an extra prize. I was talking on the phone with one of our members earlier. We have to be thinking of healthcare as an extra prize, as multiple organizations and individuals who are connected. And how do we begin to solve that issue and move forward from there? You will have in your chat this folder for our membership benefits available to you. You can also download it at the address listed at the top. I won't subject you to reading the eye chart, but we offer membership services for payers and providers, for government and associations, and for vendors. We want to bring the whole health data community together. So we have a range of membership services that are tuned to these types of organizations. So please take a look at that. If you're not a member, or if you are a member and you want to learn about some of the things we'll be doing new, that's a good place to look. So now, let me take you to the subject at hand. And the subject at hand is as follows. We are going to be introducing a new forum, or I should say an evolved forum in 2023. For those of you who read our newsletter, we started a forum called the CIO Forum back in the late 90s. And many of you know it as a group of payers and providers who came together. They left their business cards at the door. We also invited vendors to participate. And the goal was a substantive discussion about health data issues of the day at a health data executive level. And the CIO Forum was immensely popular. In many respects, it was one of the crown jewels of MHDC. And for years, it was chaired by folks such as John Halamka, who many of you know, Bill Fandrick, the former CIO of Blue Cross Blue Shield of Massachusetts. And it's chaired today by David Carusio, the Chief Technology Officer of Point32 Health, and William Young, who is the Chief Information Officer at Berkshire Health Systems. We're going to be evolving that CIO Forum to what we call the Executive Forum in 2023. It will meet 12 times in 2023, every month, the second Thursday from 9 to 10 a.m. We will also have an extended 30-minute discussion after that from 10 to 10:30 for those who want to remain in the discussion and who want to continue with those colleagues who are sitting around the table, literally or figuratively. Figurative to start. We're going to be doing these remotely. If you wish to continue, our focus is to do this quickly, to move quickly through the issues. We have 1 hour, and we have senior executives and industry leaders who will be participating with us. And we want to get the maximum benefit of these industry leaders in helping us frame our conversations about health data, to help us frame our conversations about policies, about interoperability across a range of different aspects of interoperability. And we want to have an engaged forum. The whole reason we call it a forum is that we want to not present, but discuss. And this will be, as I've mentioned, a members-only benefit. We invite senior executives, vice presidents and above who are interested or immersed in health data from our member organizations to participate. And you can see the agenda is a welcome and framing of the topic, very briefly, a guest expert introduction, again, briefly, a little bit more than the welcome, and then we get right into active discussion. This is very exciting for us because this is a chance for us to bring the old CIO Forum into the 21st century and into the 2020s, if you will, and talk about how health data is evolving, what is required from a regulatory perspective, what are some of the elements of interoperability that are essential. And we live and breathe interoperability as a consortium, but we also know that other people have much work to do that does not address interoperability. But if they want an immersion in what experts in the field think about interoperability, the forum is the place to do it. So we're excited to bring this to you today. Let's look at what we're going to be discussing in 2023. We have, in the forum series, we're starting with, excuse me, I jumped the gun there a little bit. Let me bring this back. Starting on January 12th, Alex Muggy from the Center for Medicare and Medicaid Services and Mickey Tripathi, the National Coordinator for Health Information Technology, will participate in our opening discussion on what is interoperability. It's a buzzword. We take it, we recognize it. Our industry is full of buzzwords and technology is worse than others. But we recognize that it is at its heart the connection between healthcare organizations, between those organizations and consumers, between those organizations and community services providers, engaging schools, clinical practices, a number of folks who need to be part of the health data system who are not part of it today. And we want to talk about that. We want to understand how interoperability works and why it is the mechanism that makes everything else in health data possible. We cannot afford as an industry to operate in isolation from each other. And interoperability is the fabric that links us together and understanding what that is. What do we mean when we say interoperability is very important. On the 9th of February, we're going to start talking about end goals. We've invited John Kelly. We have a second guest who we are talking with to join John, but we want to talk about end goals, and we want to focus our discussion on about interoperability on use cases, end goals that resonate with what's most important today. And there are a number of things that are very important today. We could look at burden reduction. We could look at health equity. We could look at the patient experience. We could look at cost reduction. We could look at a whole bunch of things that people say this is the most important reason for us to have interoperability. Well, we don't disagree with those folks, but we think there are two that we really want to focus our discussion of interoperability on, and those are health equity and the patient or the member or the consumer's experience. We know today that we have an inequitable health system. We know today that organizations are doing their best to make up for decades, if not, centuries of inequity. And it's not going to happen overnight. And as a journey, as we described earlier, if we want to go far in health equity, we need to do it together. We also know that we need to do the same with the experience of consumers with the health system, which, especially because of COVID, which has exacerbated so many of the challenges the industry is facing, we know that the patient's experience is pretty dreadful. It's very difficult to get an appointment. It's very difficult to feel that you have any stake in your own health experience. And it's not because we have an industry that isn't trying to do the right thing. It's because we have an industry that is not sufficiently organized, informed, and prepared to deal with these issues at the level that today requires of them. And we want to help. So our end goals are going to be focused on health equity and the patient experience. On the 9th of March, we're going to talk about some use cases within health equity and patient experience. We're inviting Dr. Mark Friedberg from Blue Cross Blue Shield to speak with us. We have a second speaker with whom we're talking now who will be joining us. Mark leads the work that Blue Cross Blue Shield is doing with healthcare providers around the state to collectively develop with their members and with their patients the proper approach to collecting and using health equity data. Health equity is, and the data associated with it, is a fraught area. Many people who would benefit most from a more equitable health system are the very same people who have considerable reasons to be mistrustful of that system. So we want to work through the use cases associated with health equity, and we also want to work through the use cases that are associated with the patient experience and learn from what other organizations are doing in these areas. So getting down from end goals to specific examples is what we're going to accomplish by the end of the first quarter of next year. In Q2, we're going to move into some of the foundations of interoperability. On the 13th of April, we're going to get into data standards, and we have Brett Marquard joining us. We will have an additional subject matter expert participating with us. But here we want to get an understanding of what are the data standards that underlie interoperability. My colleagues at MHDC and many of our colleagues in the industry are quite familiar with some of the acronyms, but many of us are not. And some of the data standards that are being promulgated and will be required by regulation for organizations to make sure that when they share data, they're sharing data that is properly standardized, properly semantically interoperable, as we would say. We're sharing what means the same thing. But we also want to understand, what are some of the benefits that derive in patient experience and in health equity from data standards? What are the data standards associated with patient demographics that help us understand equity? What are some of the standards associated with disability that help us understand equity or inequity? What are some of the standards associated with the patient experience that are going to help us understand that experience as an industry and not just within our own organizations. On the 11th of May, we're going to get into exchange standards. Data is the content of the transaction, if you will, the content of the information that is shared between organizations. The exchange standards are the vehicle by which that content is shared. And this is a new technology. This is a new way of exchanging data. Many of us are familiar with terms such as FHIR, APIs, but many more of us are not. And we want to understand those and make those topics related to exchange clear and more intuitively obvious to our members and our participants in the forum. So, how do these exchange standards work? What are they? What regulations mandate their use? And how do they help promote equity and improve the patient experience? These are standards for data and standards for exchange are interdependent, inseparable, and need to be done together. So understanding them both with the expert advice and subject matter expertise of Ruby Raley from Axway, who is an API or an application programming interface expert, who can bring the technology and the acronyms down to earth for us to understand. And Marianne Yeager, who leads the Sequoia project, which is the TEFCA, Trusted Exchange Framework and Common Agreement effort that's underway to allow providers to share information directly with each other through their electronic medical records using common standards for exchange. Both of these are two different approaches to achieving the same goals. Some lend themselves better to some use cases than others, but both are in play in the marketplace. And one of the things we understand as a consortium is purity is not an option when it comes to successful interoperability. Hybrid solutions are the best solutions because they recognize the complexity of the world. So we need to understand how APIs, application programming interfaces, and document exchange, which is the basis for TEFCA, how those two different standards for exchange coexist. And where does one end and the other pick up, excuse me. So that's what we have for May. For June, we're going to start getting into apps. We have Jennifer Blumenthal, Graham Dufault, and Kristen Valdez joining us. They're subject matter experts across a range of elements of the app ecosystem. But we know that third-party apps are going to be how consumers interact with their health data. They're not going to be logging into portals. They're not going to be expecting to receive paper files or large attachments in their emails when they look for their health data, unless they want them. The regulations will allow them to do that. But many people are going to want to see this on their digital device, their smartphone, their computer at home. How do these apps, some of which are useful for people who have particular disease conditions, some are useful for people who belong to particular health plans or work with particular providers. And just as we do on our iPhones and our Android phones today, we have a host of apps that enable us to access the universe that is, the digital internet made available over these smart devices for a range of purposes that we decide and determine. This is what's going to happen in healthcare. How are apps regulated today, and how will they be regulated in the future? How do we protect privacy when people are sharing their health information with health data apps? And how do these apps impact work and promote health equity in the patient's experience? There are a number of models in play. There are a number of organizations that are building apps in this space. We want to talk to these experts and learn more about what they can tell us. I'm going to stop for a moment because I'm halfway through the year, and I want to take any questions and open up this discussion just in case any of you would like to weigh in and ask us a question or two before I start droning on again. All right, I will take that as a ringing endorsement that we're doing a good job. So I'm going to move forward here. Starting in the third quarter on the 13th of July, we're going to get into the essentials of interoperability. What are the component pieces? And we have Alex Goss and Patrick Murta joining us, both experts in interoperability, both seasoned practitioners in standard setting organizations, in early adoption of modern technology to advance interoperability. And this session will really be devoted to the questions, what do I need in order to implement interoperability and data exchange within my organization? What are the business process and non-technical elements of interoperability that I need to understand? This exchanging data, sharing data creates an entirely different culture for healthcare than the one we have today. And what do I need to know as an organization that is undertaking interoperability that will help me learn to avoid the mistakes that can come with this and learn from the experts who have done this before? On the 10th of August, we'll be getting into some of what we call the essentials of interoperability at a specific level. First, with Ryan Howells, we're going to be talking about identity and authentication. Many of you struggle with the challenge of patient matching. Well, using our iPhones or our Android devices, we are able to authenticate ourselves by either using our fingerprint, a facial scan, and not only do we communicate that we are the person who is logging into the system, but we are also communicating that we are who we say we are, that someone hasn't stolen my password and username. I am providing you not only the credentials that enable me to access my health data, but I'm also providing you the identity that proves that I am who I say I am. We need to understand how this works because this is going to inform the discussion about patient matching, authentication of users. What are the key components of why are these key components of a successful data exchange? And what emerging industry standards are a fit with your organization's interoperability goals? But identity and authentication are an essential aspect of interoperability. And Ryan Howells is one of the industry leaders in this. We're going to then move on September 14th, to privacy and consent. What does privacy and consent look like in an interoperable health data system? How can we protect ourselves against data loss and data misuse? How can we collect and enforce patient sharing preferences when every individual patient or member or consumer has their own perspective on how much they want to share, their own choices to make? How do we collect and share sensitive health data that patients might be reluctant to provide? And how do we provide assurances to those patients that their data are shared only with their privacy and consent? Critical understanding. Hannah Galvin, a physician and a privacy and consent expert from the Cambridge Health Alliance, will be joining Seth Proctor, an industry expert, to talk to us and to help us have an informed discussion about privacy and consent. And then lastly, to round out and finish the year, we're going to get into the last of our essentials. We're going to be talking with and having the input of Adam Green, who is an attorney, a leading attorney and spokesperson around security compliance. How do you ensure data being exchanged is secured and interoperable systems are protected from either intrusions, bad actors? And when do regulations say you can refuse to exchange data because of security concerns? And how do you apply those rules within your own organization? Those and other questions are critical because understanding compliance with security in a world where health information is going to be much more freely exchanged is critical. This isn't a free-for-all. This has to be managed, it has to be understood, and we want to inform our members' understandings of the essentials of security compliance as part of interoperability going forward. On the 9th of November, we'll have John Halamka, an alum of MHDC and one of our distinguished members, and Stephen Konya joining us to talk about uses of artificial intelligence. Having a standardized and common health data system enables technologies like artificial intelligence, machine learning, robotic process automation, et cetera, to operate as best as they can. One of the great challenges to artificial intelligence algorithms, machine learning algorithms, is that the underlying data are deeply flawed. And a 21st century health data system should eliminate the vast majority of those flaws in the current health data system and promote the better use of these technologies, these advanced technologies, especially as they relate to health equity and the patient experience. So lastly, on the 14th of December, we will do something similar to what we're going to be doing later this month, or early next month, I should say, when we are going to look at an interoperability success story for 2023. And we'll bring in guest experts as we get further into the year, but we can't predict the future. We do know in 12 months' time that the world is going to look different. The health data world is going to look different tomorrow than it does today. And we want to be able to bring you the most current and most informative examples of real world implementations and success stories that will round out the year and give you a sense of what has happened and round out the curriculum, if you will, for the entire executive forum. You can find the folder for the executive forum at the address I've included, and I believe we've also attached a copy of the forum flyer for you to download in the chat window of your Zoom screen. So with that, whoops, excuse me. There we go. Let me go back to where I was. So with that, why don't we take a moment in the time that we have and get your perspectives and have you share some of your thoughts with us, given what you've learned today about what we have planned in our executive forum for 2023. Please feel free to unmute your microphones. You have the floor. We'd be interested to hear from you and respond as best we can.
Denny, this is Ferris. Fascinating, wonderful outline, huge challenges to take on. I see a dichotomy that we're all struggling with because all of these topics start in the C-suite in the executive office and go all the way down to the front line. Any thoughts on how this level of detail gets, or how the CIO, as part of the executive suite, gets the discussion or the summary of this into the C-suite discussion? Because without that support, we continue to struggle.
Ferris, that's a great question. And if we're not focusing on the business value of interoperability, we've missed the boat. Now, healthcare providers and healthcare payers know that when it comes to health equity, when it comes to the experience of the patient or the member, that they have a lot of work to do, and that this is a C-suite issue. This is a measure of their effectiveness as healthcare organizations. The regulators, CMS and ONC, but especially CMS, have made health equity and burden reduction and the improvement of the consumer's experience the heart and soul of their regulatory agenda. So I think for those who participate in the executive forum in 2023, we want to provide them with, the kind of handout they would be able to take to an executive meeting and say, the reason we should be paying attention to this is because our business depends on it. And why does our business depend on it? Because if we're shown to be inequitable in our delivery of healthcare or in our financing of healthcare, we're going to suffer the consequences, which could be substantial as far as the regulators are concerned. We're going to lose members. We're going to lose patients to those organizations who attend to these issues better than others. So I think you're absolutely right. And that's one of the reasons we picked these areas of focus. We didn't say we want to do this because we love talking about data. We're a bunch of gearheads, and we can't, we just want to share it with you. We're all excited about it. No, we recognize that an interoperable health system is essential for business going forward, and it will be the drawing line between organizations that succeed and organizations that fail. And it's a difficult change, and CEOs are going to have huge cultural transformations within their organizations to spearhead. They're going to have huge financial decisions that they're going to have to place bets on and understand. I'm going to close. I guess I will keep my screen up so when I stop sharing, folks can complete the survey. But anyway, we really are taking a business focus. And if these don't return business value, they're not on the table. So I think it's incumbent on us as MHDC to provide the participants in the executive forum with what they need to take back to the C-suite and to their colleagues in the C-suite that says, this isn't important because we all want to do the right thing. We're not operating in a world of bad actors. We're operating in a world of people who generally aspire to do the best thing, some better than others. But it's an industry built on helping people. And yet we're not doing the best job at it. And increasingly, the economic future of these organizations is going to be measured by how well they do that. So understanding interoperability as it relates to fundamental business goals, and business goals include clinical quality, they include burden reduction for clinicians, they include a bunch of things, but all of those are business goals because they result in economic value or economic loss if they're successfully or unsuccessfully implemented. So, this is what makes CEOs pay attention: is what is the economic value add for me doing this? What is the economic value loss for me not doing it or doing it badly? And we need to present that as we go through this process as clearly as we can.
Terrific. Thanks, Denny.
You're welcome. Other questions? Please speak up. This is MHDC. We love to have conversations like this.
Hey, Denny, it's Dave. I'll make a comment if I could.
Sure.
And I'd like to see a show of hands. I don't know how many people used to or did participate in the past CIO forums, or I think it was essentially called the forum or the CIO forum that we had previously with MHDC. I was participating in those for a while, and those were intended to be executive level, CIO level meetings, although, those lines have become very blurry in my mind, at least during COVID in particular. And as more and more meetings have become virtual, we've certainly expanded the reach of meetings and that sort of thing. And I think this forum meeting is an intention to try to resurrect that spirit, if you will, but be open and inclusive to those that would like to participate in those conversations and discussions. Is that correct? Is that how you see it? And is that how I guess folks on the call would perceive it as well? Because I think that those were very, very useful for having those cross-entity, cross-enterprise conversations around all the topics that we just went through and that we'll be talking about in this series. So well, for me, it's valuable. For me, it's valuable as that sort of purpose, if you will.
And I know some of our colleagues and some of our board members are veterans of the CIO forum. Leon, you're showing thumbs up. Mm-hmm. What do you remember, and what do you see as valuable about this as we go forward?
Yeah, so I'm a little bit unique in that I don't work for a provider or for a payer, but it's a provider organization, I guess, and the Uber sense, but being able to bring the information from the people who were leading, going through EHR adoption and HIE interoperability, the government affairs, the efforts. I thought having the right people in the room to have those discussions was absolutely invaluable to me to bring back to the Mass Medical Society. And since I'm sort of chief cook and bottle washer over there in terms of this type of focus, it really helped me be able to go drop by different people's office and say, hey, look, I picked up something at MHDC at the CIO forum that I think you really want to know about. And so it really gave me the a lot of really great information to be able to bring back to the organization. And again, I'm probably the person that because I'm not a CIO, and I'm a director level, but I would feel really shut out if I wasn't invited.
Yeah.
You're invited, Leon. Of course you're invited. We don't mean to be exclusive. We just don't.
No.
We want to be inclusive, and
Yeah,
you're a member of our board of directors. You're in whether you want to be or not. So
okay,
we're delighted to have you.
Terrific. But yeah, I mean that's really it was really probably the most valuable meeting I went to, in the period of around HIT during the period of a month. It was just amazing.
Thank you.
Denny, this is Janice. Can I just add an
Janice.
additional response to Ferris on his question?
Sure.
Another component is that we also see the different components of MHDC working together. And one thing that we see potentially happening, of course my phone would go off while I'm talking to you, is that you can also look at the work of the DGC as a continuation of the topics that we're talking about in the executive forum. And when you identify people in your organization that you think should be involved at that level, you can have them participate at the DGC level and go down a layer at the more nitty-gritty level to talk about these issues and work them out and work through some of these issues.
Great. And the DGC is the Data Governance Collaborative for
that's right. I apologize. I didn't mean to use an acronym that might not be known.
That's all right. I'm trying to keep my acronym antenna tuned, so I'm catching. But the Data Governance Collaborative, which Janice leads, gets into the details of interoperability at a level below this, and is also part of our membership benefits in 2023, and it sort of adds that level of detail and attention to the specifics of interoperability that a once monthly forum wouldn't be able to address.
Excellent. Thanks, Janice.
Other questions? Other comments from folks? Other thoughts? Well, I want to thank all of you for joining us today. We're excited about 2023. We're going to be doing a number of things in 2023 that we'll be sharing with you in the weeks to come. But the executive forum is a return, it's sort of forward into the past. We want to bring back the CIO forum and the level of engagement and interaction among competitors, among peers, among people who sat on the opposite sides of the table when they did a contract with each other, coming together and talking candidly about challenges that they share. And those challenges have only increased, both in number and in complexity. So by having a community of dedicated, knowledgeable folks listening to others who have expertise in this area, we can do our share to help folks understand what interoperability really means. It is a buzzword, but it means connection. It means sharing information. It means standardization of data and the use of data to achieve the kinds of goals, as we've described, health equity and the patient experience, that are otherwise extraordinarily difficult, if not impossible to achieve without. So we're very excited to have you join us, and please feel free to inquire about membership at info@mahealthdata.org. We will be closing out shortly. And we will, I will stop screen sharing at this moment and say thank you to you all. And I look forward to working with you in 2023. And nobody objects to getting out of a meeting a few minutes earlier. So we're delighted to have you today. We're delighted to send you on your way. And we thank you for joining us. This meeting is adjourned. Thank you all.